Abnormal thyroid causes general weakness. The thyroid gland is a butterfly-shaped organ located at the base of the neck that plays an integral role in regulating the body's metabolism, energy levels, and overall health. Despite its small size, the thyroid gland has a large impact, affecting nearly every cell in the body. When the thyroid gland is functioning optimally, it produces the precise amounts of hormones needed to maintain a healthy metabolic rate. However, when the thyroid gland is not functioning properly, it often manifests as general weakness, fatigue, and many other systemic symptoms. The thyroid gland produces two main hormones, triiodothyronine, T3, thyroxine, T4. Hypothyroidism, or an underactive thyroid, is when the thyroid gland is unable to produce enough T3 and T4 hormones. This condition can be caused by a variety of factors, including autoimmune diseases, iodine deficiency, certain medications, and genetic predisposition. Regardless of the cause, the result is a slowed metabolism, which can greatly affect the body's energy levels. How hypothyroidism causes general weakness. Reduced energy production. Thyroid hormones are essential for converting food into energy. When hormone levels are low, the body's ability to produce ATP, the main energy currency of cells, is impaired. This can lead to extreme fatigue and general weakness, even after minimal physical activity. Muscle dysfunction and myopathy. One of the less obvious but important effects of hypothyroidism is its effect on muscles. Patients often experience muscle pain, stiffness, and weakness, especially in proximal muscles, such as thighs and shoulders. This is due to altered protein synthesis and reduced muscle metabolism, which impairs muscle strength and endurance. Weight gain and its effects on physical health. Hypothyroidism often leads to weight gain because metabolism slows down. The extra weight can exacerbate feelings of fatigue and weakness, making physical activity more difficult. As a result, patients can fall into a vicious cycle of reduced activity and increased fatigue. Mental and cognitive fatigue. In addition to physical weakness, hypothyroidism can cause severe mental fatigue. Patients often describe experiencing brain fog, which is characterized by difficulty concentrating, memory problems, and an overall feeling of sluggishness. This cognitive impairment can further reduce motivation and energy levels, adding to an overall feeling of weakness. The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disease in which the body's immune system mistakenly attacks the thyroid gland. This causes chronic inflammation and gradual destruction of thyroid tissue, which results in decreased hormone production. In addition to fatigue and weakness, Hashimoto's thyroiditis can cause weight gain, dry skin, hair loss, cold intolerance, and depression. Iodine is an essential nutrient for the production of thyroid hormones. Hypothyroidism may occur in areas where iodine intake is inadequate. Even mild iodine deficiency can impair thyroid function, leading to subclinical hypothyroidism, where symptoms may be milder but still severe. The introduction of iodized salt has greatly reduced the prevalence of iodine deficiency, but it remains a concern in some parts of the world. Certain medications, such as lithium, used to treat bipolar disorder, can interfere with the production of thyroid hormones. In addition, medications used to treat hyperthyroidism, such as radioactive iodine therapy or thyroid surgery, can sometimes cause hypothyroidism as a side effect. Some people are born with an underactive thyroid gland, a condition called congenital hypothyroidism. If left untreated, this can lead to severe developmental delays and permanent intellectual disability. While hypothyroidism slows everything down, hyperthyroidism does the exact opposite. In hyperthyroidism, the thyroid gland produces excess amounts of T3 and T4, which speed up the body's metabolic processes. At first glance, one might think that a faster metabolism would translate into more energy. However, the truth is quite different. Increased metabolism forces muscles to work harder than usual, even when at rest. Over time, this can lead to muscle fatigue and weakness, especially in the upper arms and thighs. Sufferers may have difficulty climbing stairs, lifting objects, or even standing up from a sitting position. The hypermetabolic state increases the need for nutrients such as calcium, potassium, and magnesium. If these nutrients are not adequately replenished, muscle cramps and weakness can occur. In addition, rapid weight loss caused by hyperthyroidism can lead to protein and muscle loss, further exacerbating weakness. Hyperthyroidism can cause palpitations, a rapid heart rate, and feelings of anxiety or nervousness. These symptoms can wear the body down, leading to general fatigue. Sufferers may feel physically and mentally exhausted from being in a state of high alert for long periods of time. Many patients with hyperthyroidism suffer from insomnia or poor sleep quality due to elevated thyroid hormone levels. Lack of restorative sleep can further exacerbate daytime fatigue and weakness. Main causes of hyperthyroidism. The main cause of hyperthyroidism is Graves' disease, an autoimmune disease in which antibodies stimulate the thyroid gland to produce excess hormones. Its classic symptoms include proptosis, enlarged thyroid gland, and widespread systemic effects such as weight loss, tremors, and weakness. Symptoms of thyroid dysfunction are often subtle and overlap with other conditions, making diagnosis difficult. To properly diagnose thyroid abnormalities, healthcare providers need to consider a combination of patient history, physical examination, blood tests, imaging tests, and sometimes specialized testing procedures.